Welcome to the National Healthcare Safety Network's Hot Topics session on catheter-associated urinary tract infection, or CAUTI, protocol. This presentation is focused on the substantial changes to the 2015 National Healthcare Safety Network, or NHSN, protocol. The full protocol is available on the NHSN website. Let's begin with the changes to the NHSN CAUTI definitions. NHSN receives a lot of user feedback about their surveillance modules. For CAUTI surveillance, NHSN users frequently identify four issues. First, many clinicians debated including fungi as pathogens for urinary tract infection, or UTI. In most patient scenarios, these organisms were clinically determined to be colonizers, not infecting organisms. Their inclusion as potential pathogens for UTI surveillance was thought to overinflate true CAUTI numbers, and their removal from reporting may make CAUTI data more reflective of prevention successes or failures. Second, clinical laboratories vary in methods for workup and reporting of urinary cultures and urinalyses. These variations have the potential to affect the number of CAUTIs a facility identifies and could affect the reliability of data reported across facilities. Third, facilities were concerned about the NHSN surveillance rule that states a fever, if present, must be utilized to meet any infection criteria for which surveillance is being performed, even if that fever is clinically believed to be due to another source. This rule was felt to be overly sensitive, especially in ICU settings where fever is frequently encountered for many reasons. Finally, in certain populations, such as ventilated or spinal cord injury patients, the small number of symptoms included in UTI criteria resulted in clinically diagnosed UTIs going unreported to NHSN because patients were unable to verbalize or sense symptoms. The goal of updating definitions is to optimize patient outcomes by producing a measure that accurately identifies most patients with UTI and accurately reflects the effects of prevention activities. The definitions are objective to facilitate consistent data collection by users and should be operational by the majority of facilities. The entire process for reviewing and adapting definitions took over 18 months and included subject matter experts from a variety of roles and facility types. Here are the updates to NHSN UTI criteria for 2015. First, existing variations in thresholds for quantifying urine cultures may result in some laboratories identifying lower colony count symptomatic UTIs, or SUTIs, while other laboratories do not. A laboratory survey conducted by the Association for Professionals in Infection Control, in collaboration with CDC, showed that raising the threshold for colony counts to at least 100,000 colony-forming units, or CFUs, per milliliter would enable the majority of labs to equally report all qualifying urine cultures. Removing colony counts less than 100,000 CFUs per milliliter from NHSN UTI criteria also removes disincentives for urine culture collection in facilities using a threshold lower than this. Therefore, the threshold is raised to 100,000 CFUs per milliliter for 2015. This means SUTI criteria 2 and 4 are no longer used. Second, subject matter experts agreed that the clinical relevance of yeast in urine is a complex issue, but in most circumstances, these organisms do not represent infection of the urinary tract. In order to increase specificity of UTI data, yeasts and other non-bacterial organisms, when isolated alone in urine culture, do not qualify as a positive urine culture for UTI surveillance. Third, to simplify surveillance, pathogens for asymptomatic bacteremic UTI, or ABUTI, are no longer limited to a uropathogen list, but instead include any bacterial organism. Based on a review of historical data, this change is not anticipated to significantly alter UTI data. Fourth, the use of positive urinalysis as an element of UTI criteria is excluded in 2015. Fifth, dysuria was almost never used for patients 1 year of age or less and did not seem to be a logical symptom for this patient population. Therefore, it is removed from the CAUTI criteria in this age group. Finally, fever is not used to exclude ABUTI for non-catheterized patients over the age of 65 years, since fever alone is not normally indicative of UTI in these patients. In 2015, NHSN surveillance protocol requires facilities to use temperatures recorded in the medical record when performing infection surveillance. Facilities should not convert documented temperatures based on hospital policy for NHSN reporting purposes. This applies to all NHSN infection definitions. NHSN will no longer require the use of core temperatures for infant criteria. Unchanged for 2015, fever is a nonspecific symptom of infection which may have more than one cause at one time. Therefore, it must be considered for all infection surveillance being performed. To subjectively choose to attribute fever to one cause but not another would reduce UTI data reliability and could also be a means for facilities to inappropriately reduce the number of reported CAUTIs. UTI definition changes, such as removing non-bacterial organisms from the list of eligible pathogens and raising the threshold of organisms to 100,000 CFUs per milliliter, should increase reporting specificity and clinical agreement. CDC recognizes the need to standardize urinalysis lab practices and reporting. Future work will include collaboration with laboratory standards associations to improve patient safety by identifying best practices. Now, let's review the 2015 NHSN CAUTI definitions for CAUTI criteria 1 and 2 and ABUTI. CAUTI criterion 1A is used for patients who had an indwelling urinary catheter for greater than 2 days and a catheter is still present on the date of event. Note that the day of catheter placement is day 1 for counting catheter days. This patient must have a positive urine culture with no more than 2 species of organisms, at least one of which is a bacteria of at least 100,000 CFUs per milliliter, and they must have at least one of the following signs or symptoms: fever greater than 38 degrees Celsius, suprapubic tenderness, or costrovertebral angle or CVA pain or tenderness. The symptoms of CVA pain or tenderness cannot be due to another recognized cause, such as urologic surgery. Again, fever, since it is nonspecific, does not have such a stipulation. If present, fever must be used as a symptom when determining if UTI criteria are met. Both elements of the criteria, the symptom and a positive urine culture collection, must occur during the infection window period. The infection window period includes the date of the diagnostic test, in this case, the date of the urine culture collection, and 3 days before and 3 days after. Please watch the Hot Topic webinar entitled Identifying Infections Using NHSN Chapter 2 Definition and Rule Changes for further guidance on determining the infection window period. CAUTI criterion 1A is also used for patients who had an indwelling urinary catheter in place for more than 2 days, but which was removed on the day of the event or the day before the event. However, when the catheter has been removed, the eligible symptom list is expanded. These patients must also have at least one sign or symptom and a positive urine culture with no more than 2 species of organisms, at least one of which is a bacteria of at least 100,000 CFUs per milliliter. These symptoms include not only fever, suprapubic tenderness, and CVA pain or tenderness, but also urinary urgency, urinary frequency, and dysuria. These additional symptoms cannot be used if the catheter is still in place, because the catheter itself may be the cause of these symptoms. The same rules about other recognized causes and the infection window period apply here as well. Patients that are 1 year of age or less are eligible to meet CAUTI Criterion 1, but they are also eligible to meet CAUTI Criterion 2. No patients over 1 year of age may meet CAUTI Criterion 2. Just as for CAUTI Criterion 1, Criterion 2 requires that these patients have a positive urine culture with no more than 2 species of organisms, at least one of which is a bacteria of at least 100,000 CFUs per milliliter, and that they have at least one sign or symptom. The eligible symptoms for this population include hypothermia, apnea, bradycardia, lethargy, and vomiting, as these are common symptoms of infection in babies. Just as fever cannot be excluded as due to another source, for the same reason neither can hypothermia. All elements must occur during the infection window period. Because this webinar focuses on catheter-associated UTI, the criterion shown on this slide is specific for catheter-associated CAUTI 2 when a catheter was in place for greater than 2 days and the catheter is still in place on the date of event or was removed that day or the day before. This differs slightly from the way the criterion is presented in the NHSN protocol, which also provides guidance for non-catheter-associated UTI. Finally, let's talk about catheter-associated ABUTI. For patients who have had an indwelling urinary catheter in place for greater than 2 days on the date of event, and the catheter is still in place, or was removed that day or the day before, they meet criteria for a catheter-associated ABUTI if all of the following are true. Number 1. No signs or symptoms of CAUTI 1 or 2, according to the patient's age, occurring on the day of the urine or blood culture, whichever came first, or 3 days before or 3 days after. Number 2. There is a positive urine culture with no more than 2 species of organisms, at least one of which is a bacteria of at least 100,000 CFUs per milliliter. And, number 3, there is also a positive blood culture with at least one matching bacteria to the urine culture, or if the matching bacteria is a common commensal, at least 2 matching blood cultures drawn on separate occasions. For additional information, a flowchart is available in the 2015 NHSN UTI protocol. The chart explains identifying CAUTIs and ABUTIs. In summary, the 2015 UTI definitions have been updated after a thorough review by subject matter experts from a variety of settings and fields. The new definitions are intended to improve patient safety and to promote epidemiologic standardization for participating facilities. Non-bacterial organisms have been excluded from the definitions, and the threshold for colony count of the urine culture has been increased to a minimum of 100,000 CFUs per milliliter. Symptomatic UTI and asymptomatic bacteremic UTI are still part of the UTI definitions, but the number of CAUTI criteria has been reduced from 4 to 2. Simplifying the criteria should encourage consistent data collection and reporting, thereby leading to improved assessment of UTI prevention activities. If you have not done so, please review the Hot Topic webinar entitled Identifying Infections using NHSN Chapter 2, Definition and Rule Changes for 2015. This webinar contains necessary guidance for properly applying the new cross-cutting rules and definitions for date of event, infection window period, repeat infection time frame, and secondary bloodstream infection attribution period, all of which are used during surveillance for UTI in NHSN reporting. That short webinar can be found at cdc.gov/NHSN/training. This concludes the NHSN Hot Topic Update focusing on CAUTI reporting changes for 2015. If you have questions, please contact NHSN User Support at nhsn@cdc.gov.